Hello, I'm Christian. I'm here at Team Dental. I was working at Catch NYC, a normal ship, and Dr. Jaffari and Dr. Newaz happened to be on the table that we're working on, and in my section, the server came up to me and told me, "Hey, there's a guy over there at that table. He wants to talk to you." I thought I was in trouble. I thought I did something bad. But nah, I came over and I went up to Dr. Jafar, like, "Hey, sir, how can I help you?" And he told me that he noticed that my smile is a little different than usual, and he wanted to know more about me. And I said, "Yeah." I told him my whole story, that I had a cleft palate and everything else, that I was going through a lot of things, and I wasn't able to complete my mission. So after everything, he was telling me about, "Hey, I work at a dental spa. I'm actually an orthodontist." I'm like, "No way." Like, yeah. So basically, he said, "I want to basically give you a nice Christmas gift." And that Christmas gift happened to be a whole year, which is amazing. And shout out Dr. Jaffari and Dr. Newaz for that. Yeah, that's how we met at my restaurant. They gave me an offer I couldn't refuse. How can I refuse that, to be honest? And from there, we're here. We're making it happen. 2025.
You're a little more
already. I was born with a cleft palate. Basically, what that is, if I can make sense from my understanding, it's when you're born, basically without the top lip combined. Usually, everybody has their lips all combined and everything. But in my case, I was not born with it. So basically, I had to go to surgery. So after my 6 months of being born, my mother had to take me to a doctor to do surgery to basically get my lips combined. And now, like, you can't really tell over here, I have a mustache, but it had like 2 scars here. That's basically the sign of my cleft palate. So basically, I was born with it, and from there on, growing up around, I'm from Bronx. I'm from the Bronx, so around there's really rough neighborhoods around. A lot of kids are really rude sometimes and make fun of you. And basically, I had to handle all that. I got in a couple fights for what they did, what they said, and I was really rough during that time. I thankfully made friends, and I met my boys. I have a whole group. We met since like 3rd grade, and ever since that day, we've been friends ever since. We grew up together and everything. But yeah, school, I was really not that bothered by it. I get asked a lot of questions. "Yo, what's up with your lips, man?" And I'll be like, "Oh, this and that, the third." And yeah, basically, it wasn't that bad. It was bad. I wouldn't say the worst. It was good. At first, I was already going through procedures to getting my stuff, my teeth aligned and fixed up. But it came to a point where everybody got shook. The pandemic happened, and a lot of stuff was like delaying hold on to. But then when everything came back together, I was able to go back to my doctor, my orthodontist actually, and they couldn't process and do the procedure again because I had to pay and my insurance couldn't cover it. And well, I said, "Dang, can't really do much," and I really don't work as much. I live in the Bronx still, so like it's really tough around there, so I couldn't pay for it. So I'm like, "Dang, I'm stuck with this for a while." And honestly, I'm not gonna lie, like, it was a little tough finding a significant other, but I thankfully found one, and I'm in love, so that's amazing. So thank God. So yeah, I thought honestly this was gonna affect me for a while. I'm like, "Dang, I have to deal with this for a minute." And well, Dr. Newaz, Dr. Jaffari, God bless them, God bless their souls. They came in clutch, and now we're here.
What procedure were they gonna do over COVID that messed like what was do you know exactly what they were gonna do?
They were gonna basically get a tooth removed from on top of my teeth because it was basically bothering a procedure that happened. But from there on, it stopped, and I forgot most of the stuff that was gonna happen.
So they were gonna pull a tooth.
Yeah.
Bro, you know they're not gonna pull any of your teeth.
Nah, yeah, I know, I heard that.
So that's low key a blessing that you didn't get any teeth pulled, bro.
No.
They are very anti-extraction, anti-tooth pulling for any healthy tooth. Like if they can save the tooth, they're gonna save it.
To be honest, this is gonna sound crazy, every day when I have my own. So everybody has their own time for themselves to like reflect on their lives. I had that one night. You all have that 3 a.m. thoughts. I don't know, like, dang, I want to do this, I want to do that. I need to do this, I need to do that. I had one night thinking, like, dang, I hope one day I'm able to get myself situated, get my money up, and be able to, like, get my insurance and do my procedure and get this right. I kept asking God. That's why God is the best. You always got to pray to God. The God's always going to be on your side. Never despise God. God is real because I asked God, my God, please give me a sign, give me something, let somebody, I don't know, something, make me get the strength, give me more, power, more energy. And yeah, He gave me a blessing. I thought your brother came in and was there. Crazy. Life was really, it's all about faith. You gotta believe in God. Fair enough. Well, I'm in like a whole bunch of emotions right now. I'm excited, I'm nervous, I'm happy, and everything. I'm beyond excited, young. Just growing up, like honestly, like sometimes like I always tell myself I wanna smile like everybody. My brothers, I have 2 brothers, shout out to them. Shout out to Elvis, Oliver, and Sergio. I always seen them with their teeth, a line, a smile. Especially my brother Oliver has a good smile, and like I'm like, dang man, I want to have a smile like my brothers, like anybody and everybody in general. And like I'm like, dang, never gonna have them, never gonna happen. I'm always gonna get judged by my teeth in this land of girls, but now we're here. I'm really excited, man. Really am.
That's cool.
Can't wait.
You know who you look like? I feel like you know exactly who I'm gonna say who you look like. Chiwiwis.
Oh yeah.
Yo, bro, he's Raul. What's his name? Raul Dosas
No.
Jr. or something?
Raul. Something like that. Yeah.
Something like that, bro. He's me and my friend's favorite fighter, bro. We be saying Chiwiwis all the time, bro. He's raw, bro. Did you see that video of that dude pranking him at the gym? He like choked him out.
Yeah, I saw that.
Yo, bro. So like when you. I know it's probably a personal question, but when you see someone like in a spotlight position like that with a cleft flip, do you feel like joy? Do you feel like oh like he could, you know what I mean?
Yeah.
How did that make you feel?
Honestly, when I first saw him, and you're actually the second person that said that look like Raul. The first time someone told me that, I was at a bar after work, and someone told me, yeah, if you look like that, UFC fighter. And like I'm like, who's that? And then afterwards, I did some research, I looked him up, and I said, wow, he kind of does look like me a little bit. So I'm like, dang. And then, like, he's a fighter. And honestly, I'm not a fighter, but I fight. But, like, I always wanted to do, like, boxing, karate. But the only thing that was kind of setting me back was that I wasn't too sure if I could because of my cleft palate. Because my mom has always told me, if you get into fights or you want to go to a professional, like, fighting, you're going to have to not really do it because you can't do that because your teeth could get messed up. And it's a lot of procedures to get that done. So I'm like, dang. But seeing that, hopefully after this procedure, after everything is done, I get my teeth aligned and fixed or whatever, I'm going to then ask Dr. Jaffari or Newaz, that if I'm able to start actually doing what I want to do. It was just like I want to fight professional, and that's what I know I'm able to, so I can get hit in the face without having no problems. Do a lot of stuff after this, so I can't wait.
That's cool.
I'm ready for whatever.
So, Dr. Hari, can you walk us through exactly what we're doing, or just kind of run us down, give us the rundown?
Yeah, so today we're going to be delivering our Christian's MARPE. So we had to specially customize our custom MARPE for the Cleft palate. And so we are going to be putting the tabs in the sides. And the goal is to expand the palate, and then we also have arms on there to help with protraction and pulling the maxilla forward. So it's going to be a work in progress, and we're going to be monitoring the way he responds to the expansion and then also the maxilla protraction, and then we'll determine when is a good stopping point. After that, then we'll do some dentistry and see how teeth are doing. Yeah, that's kind of the game plan. So basically, we were at Catch in New York, and that's my wife's one of her favorite restaurants.
Amazing restaurant.
The amazing restaurant. And so we sometimes go there because that was sashimi or something. Yeah, the sashimi. Not chop or sashimi. But we went there for that chop sashimi. Amazing. And so Dr. Newaz are sitting next to each other, and so we're just talking, and we see a waiter, and we see a Christian, and we obviously it's our career to notice these things. Yeah. And so we noticed that he has the cleft, and so we're like thinking about it, we're like talking about it, like we're like, what it's Christmas time, like tis the season, like so Dr. was like, yo, what if we hooked them up with a free orthodontic treatment? Yeah. And we're like, and then we're kind of like embarrassed a little bit, and we're like a little shy. So I don't know if you noticed, I introduced us incorrectly. I'm like, I'm Dr. Newaz, I'm Jaffari, and I'm Dr. Jaffari.
Hello, Dr. Newaz. Hey, what's going on, man? Good. How about you?
See you, man.
You as well. You excited?
Oh, very excited, man.
Yeah, buddy. Let's get it.
A little nervous, but excited.
Hey, yeah.
So we're super excited too.
Yeah.
So have you ever worked on a case like this?
Christian's case is a little bit different because of the cleft. So we had to kind of customize the MARPE, and then traditionally treatments are if you want a surgical approach. But our toolbox is expansion, orthodontics. So we're gonna try this out and see what kind of results, and then we still have a lot of contacts in the oral surgery realm to see how we do before we move on to the next piece. So it's definitely a little different for us. Dr. Newaz?
Yes, sir.
Have you ever worked on a palatal expander or the Cleft patient before?
Well, so I mean, definitely in younger individuals. So this will be like, I guess like doing MARPE on a prior cleft patient is definitely a little bit of new territory for us. Yeah. But and that's why the planning had to be unique, right? We have to think about areas where the bone interfaces are not quite normal in the development, right? Developmentally, a lot of the bone near the midline, it's not just your classic case where you can kind of put 4 screws in the middle or 6 screws in the middle, right? So we had to look for anchorage a little bit on the sides, just to get that volume, to be able to expand the palate. So, that's why we kind of have this design, butterfly design, where we mostly use the alveolar because there just simply isn't enough bone for anchorage in the palate. But we need some of the room, and we need bone anchorage to protract the maxilla. But we do think that with some of what we see as relatively weaker bone connections, that we feel, somewhat optimistic about the potential to protract the maxilla in his case, and see if we can bring him out of that underbite tendency, at least to some degree. And especially with the ensuing orthodontics, I think this space is going to create room to align some of what we do have for teeth, and then of course create some space around them. We prosthetically build them up a little bit, and so between the jaw expanding and moving forward, and between of course aligning and distributing space smartly in front teeth, I think we feel optimistic about at least being able to reduce the severity of the underbite, and see what we can do.
Did you even know what a MARPE was before they came up to you?
Not a clue, man. MARPE, what?
Yeah, I have MARPEs, expanders, yeah. So the one that Dr. Newaz had, that you definitely wouldn't be able to have that because you have bone in the middle. That's strictly a bone for an expand. Okay, that's called FME. Yeah. Now that we're probably one of the few offices in the world that does that right now. So that's a little bit our one of the things that we offer. Yeah. So like when you go and like if you see the Gannett post or whatever like that, that's what it makes us kind of.
Yeah, you're gonna see the video TikTok. I've watched a couple of videos.
So, yeah, the FW one.
Mm-hmm.
Yeah.
Oh my god, like the procedure is fake. Yeah, I can't wait.
Oh yeah, you swagged out.
Feel like a cholo now. About the procedure? No. Right, so today I'm going to be getting you numb. We're going to be using anesthetic. Okay.
How long does it last for?
The anesthetic?
Yeah.
Couple hours. I'm going to give you a little bit more at the end. I'll let you basically through the night or to the night. Okay. little pinch, okay?
How many custom MARPEs do you think you've installed?
In the past year,
Yeah.
FME and MARPEs combined,
Yeah.
50?
That's crazy.
50? No, maybe more.
Maybe more.
Maybe like 60? 70?
That's wild.
1 a week.
One a week.
20.
Is it numb? Is he getting numb?
I can't even speak. How that works.
I know it's quick too.
That was gonna be like 5 minutes, not like that.
If this is a strong anesthetic.
So when you say this is one of the advantages of custom RP over FME? The customization, yeah. Because, so one of the advantages of custom RP over FME is they will customize as such.
Do you have a monojet in Paradex? Can I get a monojet? You okay? Well, maybe take that out and turn the one in.
Similar sizes. How many tabs for around the alveolar bone? 22.
Who decides how many tads are in?
We do. The Newaz custom designers. They're
Gotcha.
super custom. We're gonna check your bite. So now, when you bite down, it's gonna feel like you're hitting on the metal. That's normal.
On both sides did it simultaneously.
Okay.
Let me just go do it same simultaneously.
Would you feel like one side taking first?
Go flat. Bring forward. Just, yeah, you feel like your hand side.
Do you feel like the right side and left side fetching simultaneous? Yeah, let's see your guys.
How you feeling, Bertie? No, this should be weird. No front thing. That's normal, right? To be like on this side.
You're trying to feel like one in the front. Yeah, then you're gonna have to get used to that. It's gonna be a open for you.
And bite down. From the top. At the top. And bite down side. Open.
All right. While we're waiting to take photos, I'm gonna go over instructions on how to start, okay?
Yeah. Like a rapper with rules.
For real.
All right. So there's 2 keys.
Alright, Dr. Warren, can you take your mask off really quickly, sir?
Okay. So there's 2 keys, right? They look pretty much the same, right? The only difference is one has a curve. This one there. Yeah. So whichever one fits is the one you're gonna use. Okay. So there's no difference. So go put your head back for me a little bit and get a mirror for us, please. Darsh. You're gonna feel like the pulsing will direct or like runny nose. That's normal too, and that will go away. Okay. The screws are literally inside your nose right now. Okay. Okay. So what you're gonna do is push your head back a little bit. So that's what we call the custom marquees. Now just go old.
Sorry, guys.
I'm gonna be there.
So let's try ritual closing. Cause yeah, like it's all the way down when it goes in. We're gonna try the other one now. It's a little bit more forwards. Okay. You can do is your turn towards the back of your throat. Open your eye. Okay. Go to the line you can. Yep. Perfect. And that's what we call one turn. Okay. Okay. So then now that one curved one, this one should now fit. See how that fits now? Okay, so I'm not gonna turn again right now because I'm gonna wait till you. But go ahead and give it a try yourself.
And be in the middle.
Yep. So right, the big screw in the middle. Yep. Right. Back over again. Perfect. Down toward you back to your throat. Open as wide as you can. Yeah. So go ahead and finish that turn. So you see how you kind of stop a little bit? So you finish it.
A little hard.
Yeah, so you're gonna get better and better, especially because right now, open wide. I'll finish that turn. I'll go all the way down. Yeah, okay. That's you did one turn, so we did 2 turns, right? Now each turn it 1/6 millimeters, so it takes 6. So it's a hexagon. It takes 6 turns for 1 millimeter. Okay. 6 rep
Every day.
Yeah, so we're gonna start off with you. I want to go a little bit slower, right? So we're gonna do every other day. Right, so we're gonna do every other day, and we're gonna try that out, and we'll see you in a few weeks. Okay? Now, what's gonna be visible is you're gonna start seeing gap forming, bigger gap around these teeth. Okay, so this is gonna start spreading. Now, what's gonna be visible is your cheekbones are gonna start basically coming out a little bit. Okay. Now, we'll get the headgear, the protraction device. We'll go over that. Can we get the weird
I know it feels weird. You'll get used to it though.
device and the rubber bands?
Hopefully,
Trust.
talk.
Yeah. It's hard to talk with it.
How was it for you?
It wasn't bad. The first like 3-4 days it was kind of difficult, but after that it was like you get used to it. You get way used to it. You'll learn how to talk. You're not gonna be like that. So you got it.
Tomorrow too.
Oh, bro, low key you might be in a little bit of pain tomorrow.
Where?
Yeah, I'm not gonna lie, bro. You might have to take some like Advil or something with you. It's not gonna be like terrible, like oh my god, but it's gonna be a little painful.
Hemophilia, right? Hemophilia.
Yeah, you're gonna feel it. It's not like terrible, but you know, first like week it's gonna be a little rough, but you'll be alright.
How many times did you return it?
I almost maxed mine out, so like 50, 60 turns.
Wow. Can you build a turn like every hour, like one time?
Oh, no. Like once every, probably they're going to do probably every 3 days. If I had to guess. I'm just guessing. I did mine, so every other day, something like that.
For right now, the reason why it feels a little weird because the aesthetic, right?
Yeah. And literally, there's metal in the mouth, so it's gonna take away from your tongue.
Yeah.
So it's gonna fill up your mouth, so your tongue may be a little bit uncomfortable. Now, usually most people get used to that in a week or two, not even, maybe a little less, right? So but cleanliness is super important. So we gotta brush after every meal, and you have to use a water pick. Yeah. So on Amazon, they're like $20, right? You do that in the morning, so it's not. But the water pick, you're gonna.
I would get a pack of salt, like a big thing of salt, and salt water rinse every single chance you get, bro.
So
Yes, a warm water and salt every chance you get when you're at work, bro. Do that thing, even if you're not eating. Use salt water rinse. No. Just like swish it around and spit it out. I would be careful with the water pick until like a few days, but I would still be trying to rinse it out as much as you can. And anytime you eat, like, be careful. Because you don't want any food getting up there, and you don't want it getting like infected or anything. Which it won't. It won't.
Is that the same size the Allen wrench that we have up there?
The other way, the same size.
It does actually.
Right.
I'll go grab it.
Yeah, actually got that. Bailey, you and then go get an Allen ring from upstairs.
Oh, yep.
Just get this. Please.
Where is your party? We have recommended water.
Yeah, do you have any water?
Yes, I can go get some water.
Is it recording?
I think so.
Yeah.
I'm just gonna get my nice sweaty armpits because I'm such a hard worker.
I love that you get that anchor.
Bruh.
Oh, it's okay.
Well, first.
Is it normal? But like, I have to right there when I had this, it would like feel pain. And I hope we get like feeling like pain right here. So the pressure, right?
In pressure. Maybe a little bit less now. You're an adult.
So cute.
That. Pretty much. Now, a lot of our patients will go like double up.
Yeah. I'll probably figure out when I get home how.
Probably double up, because the more force. What? Yeah. Because you're at the more mobile individual. Right, so there's a punch. Once you're done using it, just throw it away. Don't save them. There's no point. Because then they lose their elasticity, so you want tight, right? So you're gonna be turning every other day, and then we'll see you in. What are we here next? April 14th? April 14th? Something like that. Here. What is it? As per the headgear. Now, if anything comes up, you can always obviously contact me or text me. Yeah. Congratulations.
No, came through.
Or it's a pleasure.
Oh, one more question.
Yeah, Barry.
Might be a little bit too fresh one.
No question with his one.
We from night part. Occasionally, I'm gonna be honest, I do occasionally smoke weed.
Just wait a couple days. If you want to do edibles, that's fine.
Okay.
For the next few days, but stay away from the smoke because I want the screw areas to heal. Now, going back to the cleanliness. You have an electric toothbrush. So go on Amazon. My favorites are either Sonicare or Oral-B. I prefer Sonicare personally. You don't need to get the $500 one. Get like the $89 one or $100. You're gonna brush your teeth. You're also gonna brush the expander, and you're gonna brush the screws, the implant screws. Yeah. And you're gonna brush the big screw too. But everything you're gonna brush everything. We don't want plaque. We don't want bacteria building up. Right. You're also gonna get a water pick. There's so many options on Amazon. Basically, even the $30 option is fine.
You don't really need to get super expensive one. Get a cordless one.
Okay.
Right? You can keep it in the shower, you can keep it in the sink, right? Literally you're gonna just, if you're, let's say, at work and you eat lunch and dinner at work, have one at work in your bag or something like that too, right? Super easy. They're only like $30, but you don't want food to get stuck, and you want that to stay up there.
Yeah.
Cleanliness is the most important.
Mandatory.
Mandatory.
It will hurt 100 times more if you get an infection up there.
Yeah, and the thing is, we don't want infections around the screws because we only have 4 screws, right? Normally, at an adult mill, we put like 6 to 8.
Okay.
Right? So those screws are very precious, so we want to make sure that nothing happens. Right? Now, there's also attached to the teeth, so it's not like, you know, if one of them fails, it's fine. We still have a lot of safety measures built in place, but we just want to make sure those are super clean.
That's it. And sometimes also, I don't think every day, but when I go out with my family, the mediation I need, is that fine?
Yeah, it's fine. Yeah. Yeah. Now just wait, like today, what, Saturday? Maybe wait till like Tuesday to smoke. Where if you need to do like edible life out of it.
That's fine. I go wait. Oh,
But protraction. The more you pull, the quicker your results are.
Okay.
Like literally.
Yeah, I get it.
Get haggy.
No.
Any other question? Yeah, we'll give you a back too. It's gonna, you're gonna feel tension over here. That's normal, right?
What do you mean?
Like when you're turning, so that expander is expanding everything. So you're gonna feel tension over here. Oh guys.
Is it gonna be like visible? Like where other people see me? Be able to see that or not?
When like we have your pictures that we started with today, basically. When you're done, you're gonna see the cheekbones more out.
Okay.
Like see how Bailey's cheekbones are really nice and defined.
Mm-hmm.
Like
Before they were very narrow, so it's just.
I don't know if you noticed Newaz, like he looks. I mean, you've only seen him maybe a couple times, but he physically, if you see his Instagram picture, he physically is wider. So your cheekbones are gonna come out and forward. So you know how like their top jaw is back a little bit. The expander itself does that, and then now with the protraction, you're gonna get that and that.
But when I happen, I'm obviously gonna feel pain. I'm good, right?
Yeah. I mean, everybody's different.
Okay.
Right? Some people will feel like tension, some people feel like pressure, right? Some people will hear like a crack sometimes. That's normal.
It's like a pop sensation once the suture splits, but then after that, it's pretty smooth sailing from there.
Got it. And it's all like aligned from like, this is for my cleft palate. It's like perfect for it, right?
But this is like a little bit out of the box type of treatments, right? But what we realize, if we expand and you create new bone on the front, that it gives us space to put in possibly implants or to make the front teeth look good too.
Okay.
Right? So we're gonna expand, bring forward, and hopefully create space for either bridges or implants and things like that. And now you have, because you're missing a couple teeth.
Yeah.
Right? Create enough space that we can actually add. I can add somehow in the future. We'll plan it out when time comes, but either implants or some paper bridges or something like that.
Yeah. Yeah, and like put a bob teeth. It's fine, right?
Well, we're gonna do braces because once we expand, we need to bring the teeth and get them ready for my next phase.
Okay.
Like the dental component. Then in the meantime, the brace will fix the bottom teeth, and we're gonna do the top teeth. Through and through.
So this for to buy this electric.
Yeah. So
I'll make the list right now.
is it going? If you have Amazon app, you have like that on here. You do that right now. So then
Put it out. I think if I need. Of course you do.
What are you most looking forward to with this? Like, what did Dr. Jaffari explain to you any of the benefits of the expander aside from the looks?
I'm looking forward to just for experience. So experience, going through everything after it's gonna be amazing. So I really give a lot of things to Jaffari, make it a future probably one of the best.
we're really excited. I think that for us it was we're privileged as doctors to be able to provide treatments to our patients. And so, it's a blessing. But then, some things that we talked about before is, a lot of people don't know they have options, right? So, you obviously phased out as the pediatric care. but there are options out there, and we want to be able to provide the service to people like yourself. Right? It means a lot to us. So thank you for putting trust in us.
No, of course, and thank you as well.
Absolutely. Yeah. Then we got the before picture too.
Yeah.
At the restaurant.
Yeah.
Can I get one right now of you just like thumbs up or something, just posing for like Instagram or something? All right, we're gonna see you. Awesome.